providing an update shortly. In conclusion, I'd like to reflect on what this authorization means for people in Canada. Overall, this is very good news for adults and children alike. It provides another tool to protect Canadians, and to the relief of many parents, will help bring back a degree of normality to children's lives, allowing them to more safely do the things that they have missed during the last 20 months. Thank you. Merci. Miigwech.
Bonjour. Merci de vous joindre à nous. Aujourd'hui, je vais vous parler de l'autorisation de Santé Canada concernant le vaccin contre la
Pfizer-BioNTech Comirnaty COVID-19 vaccine in children 5 to 11 years of age. This is the first vaccine authorized in Canada to prevent COVID-19 in younger children, and it is another key step in Canada's fight against COVID-19. I'll start by walking you through Health Canada's stringent review process and the data we reviewed. I'll finish with some important information on COVID in children. On October 18th, Health Canada received a submission from Pfizer-BioNTech to authorize the use of its vaccine in children 5 to 11 years of age. Our assessment included a review of new clinical trial data that built on earlier lab data, data from clinical trials in adults and adolescents, and real-world data on the use of hundreds of millions of doses worldwide. The trials followed approximately 4,600 children aged 5 to 11 years. 3,100 received the vaccine, 1,500 received a placebo. The studies used a two-dose vaccine regimen given 3 weeks apart, but with a slightly different formulation than the one authorized for adults. The dose is also smaller, at 10 micrograms rather than 30. To determine whether the vaccine is effective, we looked at the immune response in children 5 to 11 compared to the response in adolescents and young adults aged 16 to 25. The immune responses were comparable. Safety data was evaluated for 1,518 vaccine and 750 placebo participants, of whom the vast majority, 95.1%, had a safety follow-up at least 3 months after the second dose. The trial also evaluated safety data from an additional 1,591 vaccine and 788 placebo participants, with a median follow-up of 2.4 weeks after the second dose. The main adverse events reported were similar to those in adolescents and young adults, but were less frequent, except for redness and swelling at the injection site, which were slightly higher. Other adverse events reported included fatigue and headaches. Most reactions were mild to moderate in severity and resolved quickly on their own. Among the 3,100 vaccine recipients, there were 4 reports of serious adverse events that were ultimately determined to be unrelated to vaccination. There were no reports of myocarditis, pericarditis, or severe allergic reactions. After a thorough and independent scientific review of the evidence, the department has determined that the benefits of the vaccine outweigh the potential risks in this younger age group. As with all authorized COVID-19 vaccines, Health Canada has issued terms and conditions on the manufacturer requiring it closely monitor any emerging safety issues, including cases of myocarditis and pericarditis. Health Canada and Public Health Agency of Canada will continue to work with the provinces and territories, the manufacturer, and regulators around the world to monitor the safety of the vaccine. We know that this collaboration has been able to identify even very rare and unexpected side effects. To date, no new safety issues have emerged from the use of the Comirnaty vaccine in children 5 to 11 years of age in the U.S., where over 2.5 million children have received this dose. This authorization comes at a critical time in the pandemic. Over the course of the third and fourth waves, incidence rates have been increasing among children less than 12 years of age who until now have not been eligible for vaccination. While children are less likely to experience complications, they can still get very sick. Although the risk of severe illness is lower in children than in adults, it is still there. Rarely, some children go on to develop multi-inflammatory syndrome in children, known as MIS-C, which has very high risks of hospitalization. Emerging data also suggests that children with COVID-19, regardless of the severity, can develop long COVID. And of course, children, like adults, can spread the virus. Now that the vaccine is authorized, I'm sure that everyone is anxious to hear how it will be used. Dr. Tam and Dr. New will be providing an update on this shortly. To conclude, I'd like to reflect on what this authorization means for the people in Canada. Overall, this is very good news for adults and children alike. It provides another tools to protect Canadians, and to the relief of many parents will help bring back a degree of normalcy to children's lives. It will allow them to do the things they have missed during the last 20 months more safely. Thank you.
Bonjour à toutes et à tous.
Hello, everyone.
Nationally, the daily case counts appear to be declining slowly, but with significant regional variation in disease activity and high infection rates persisting in many areas of the country. Over the most recent 7-day period, an average of almost 2,400 new cases were reported daily across Canada. Severe illness trends are also slowly declining, but some areas are still struggling at or above critical care capacity limits. As noted, unless we can keep infection rates down, severe illness trends could begin to rise again. Over the past week, on average, over 1,680 people with COVID-19 were being treated in our hospitals each day, including 487 in intensive care, and 25 deaths were reported daily. As the pandemic has progressed, we've learned, honed, and strengthened ways to manage as well as make headway against the formidable challenges of this virus. Canada's COVID-19 vaccines continue to provide excellent protection against severe illness. And although there's some evidence of decreased protection against infection over time, we are continuing to make important advancements in vaccine programs to preserve and extend their protection and help reduce spread as well. Over the past several months, regulatory approvals from Health Canada and recommendations from the National Advisory Committee on Immunization, or NACI, have allowed provinces and territories to adjust targeted vaccination programs to ensure that key populations can achieve and maintain protection against COVID-19. Approval of a pediatric COVID-19 vaccine has been long anticipated. Today, the new lower dose pediatric formulation of the Comirnaty COVID-19 vaccine by Pfizer-BioNTech is being authorized by Health Canada as Canada's first COVID-19 vaccine for use in children aged 5 to 11 years. And NACI is recommending that a complete 2-dose series may be offered to children in this age group who do not have contraindications to the vaccine. As well, based on emerging evidence from adult immunization, which suggests longer intervals result in a stronger, longer-lasting immune response and may lower the risk of myocarditis and pericarditis, NACI is also recommending a dosing interval of 8 weeks or more between the first and second dose. As our Health Canada colleagues have indicated, the new lower dose pediatric formulation is 10 micrograms compared to the 30 microgram dose for adults and adolescents aged 12 years and older. Data shows that the 10 microgram dose works very well at preventing symptomatic COVID-19 in children aged 5 to 11 years, with an estimated efficacy of 90.7%. This is very similar to the level of protection achieved with a 30 microgram dose in adolescents and adults. Given the current and prevailing epidemiology of COVID-19 in Canada, where incidence rates have remained highest in children aged 5 to 11 years for most of the fourth wave, today's announcements on the availability and use of the pediatric formulation provides a welcome additional prevention option. Following excellent uptake of the 30 microgram dose among older children aged 12 to 17 years, there has been a notable reduction in infection rates and outbreak-associated cases in that age group. As such, it is hoped that the new pediatric programs will have similar success in younger children and contribute to increased population coverage overall. At this time, NACI recommends that young children receive the 10 microgram Comirnaty vaccine at least 14 days before or after receiving another vaccine. This precaution is being made to help determine if a side effect that may arise following immunization is due to the COVID-19 vaccine versus another vaccine. However, there may be circumstances where it is necessary for a dose of the pediatric COVID-19 vaccine to be given at the same time as another vaccine, in which case a healthcare provider can help with decision-making. To date, no serious safety concerns have been identified in the clinical trials. Going forwards, we will be closely monitoring domestic rollout of the pediatric program in Canada and continuing to review accumulating evidence from international programs and studies. During this time, it is very important that we support children and their caregivers in making informed decisions about COVID-19 vaccination while respecting their choices and pace of decision-making. It is perhaps very fitting that tomorrow is National Child Day and World Children's Day, dedicated to celebrate child and youth rights. This year is an opportunity to say a special thank you to children and youth for the sacrifices they've made during the pandemic and to recognize their resilience. UNICEF Canada is encouraging Canadians to go blue to say thank you. Join in as we show our kids how important they are in shaping their now and the future. From people to places, we can all shine blue for them, including monuments in Canada like Niagara Falls and towers in Toronto and Calgary and more all around the world. So thank you. Merci. Miigwech.
Bonjour à toutes et à tous.
Hello, everyone. Nationally, daily case counts appear to be declining slowly, but with significant regional variation in disease activity and high infection rates persisting in many areas of the country. Over the most recent 7-day period, an average of almost 2,400 new cases were reported daily in Canada. Severe illness trends are slowly declining, but some areas are still struggling at or above critical care capacity limits. As noted, unless we keep infection rates down, severe illness trends could begin to rise again. Over the past week, an average of over 1,680 people with COVID-19 were being treated in our hospitals each day, including 487 in intensive care, and 25 deaths were reported daily. As the pandemic has progressed, we've learned, honed, and strengthened ways to manage, as well as made headways against the formidable challenges of this virus. Canada's COVID-19 vaccines continue to provide excellent protection against severe illness, and although there is some evidence of decreased protection against infection over time, we're continuing to make important advancements in vaccine programs to preserve and extend their protection and to help reduce spread as well. Over the past several months, regulatory approvals from Health Canada and recommendations from the National Advisory Committee on Immunization, or NACI, have allowed provinces and territories to adjust targeted vaccination programs to ensure that key populations can achieve and maintain protection against COVID-19. Approval of pediatric COVID-19 vaccines has been long anticipated. Today, the new lower-dose pediatric formulation of the Comirnaty COVID-19 vaccine by Pfizer-BioNTech is being authorized by Health Canada as Canada's first COVID-19 vaccine for use in children aged 5 to 11 years. NACI is recommending that a complete 2-dose series may be offered to children in this age group as long as they do not have contraindications to the vaccine. As well, based on emerging evidence from adult immunization, which suggests that longer intervals result in a stronger, longer-lasting immune response and may lower the risk of myocarditis and pericarditis, NACI is also recommending a dosing interval of 8 weeks or more between the first and second dose. As Dr. Sharma and our colleagues from Health Canada have indicated, the new lower dose pediatric formulation is 10 micrograms compared to 30 microgram dose for adults and adolescents aged 12 years and up. Data shows that the 10 microgram dose works very well at preventing symptomatic COVID-19 in children aged 5 to 11 years, with an estimated efficacy rate of 90.7%. This is very similar to the level of protection achieved with the 30 microgram dose in adolescents and adults. Given the current and prevailing epidemiology of COVID-19 in Canada, where incident rates have remained highest in children aged 5 to 11 years for most of the fourth wave, today's announcement on the availability and use of the pediatric formulation provides a welcome additional prevention option. Following excellent uptake of the 30 microgram dose among older children aged 12 to 17 years, there has been a notable reduction in infection rates and outbreak-associated cases in that age group. As such, it is hoped that a new pediatric program will have similar success in younger children and that it will contribute to increase population coverage overall. At this time, NACI recommends that young children receive the 10 microgram Comirnaty vaccine at least 14 days before or after receiving another vaccine. This precaution is being made to help determine if a side effect that may arise following immunization is due to the COVID-19 vaccine versus another vaccine. However, there may be circumstances when it is necessary for a dose of the vaccine for children to be given at the same time as another vaccine, in which case a healthcare provider can help with decision-making. To date, no serious safety concerns have been identified in the clinical trials. Going forward, we will be closely monitoring domestic rollout of the pediatric program in Canada and continuing to review accumulating evidence from international programs and studies. During this time, it is very important that we support children and their caregivers, in making informed decisions about COVID-19 vaccination, while respecting their choices and the pace of their decision-making. It is perhaps very fitting that tomorrow is National Child Day and World Children's Day, dedicated to celebrating child and youth rights. This year is an opportunity to say a special thank you to children and youth for the sacrifices they've made during the pandemic and to recognize their resilience. UNICEF Canada is encouraging Canadians to go blue to say thank you. Join in as we show our kids how important they are in shaping their now and the future. From people to places, we can all shine blue for them, including monuments in Canada like Niagara Falls and towers in Toronto and Calgary, and more all around the world. Thank you. Merci, miigwech.
Merci, Dr. Sharma, Dr. Bertillon, Dr. Tam, and Dr. New. Thank you. We will now open the phone line to questions. We ask that you limit yourself to one question and one follow-up. We will be taking your questions in both official languages. Nous allons prendre des questions. Nous vous demandons de vous limiter à une question et une question suivie. Vous pouvez poser vos questions dans l'une des deux langues officielles. So, operator, first question, please. Operateur, première question, s'il vous plaît.
Thank you. Merci. We will now take questions from the telephone lines. If you have a question and you are using a speakerphone, please lift your handset before making your selection. If you have a question, please press star 1 on the device's keypad. You may cancel your question at any time by pressing star 2. So please press star 1 at this time if you have a question. There will be a brief pause while the participants register. We thank you for your patience. Nous allons maintenant passer à la période de questions. Si vous utilisez un téléphone main libre, s'il vous plaît, soulevez le combiné avant d'effectuer votre sélection. Si vous désirez poser une question, veuillez s'il vous plaît appuyer sur les touches étoile 1 de votre appareil. Vous pouvez à tout moment annuler votre question en appuyant sur les touches étoile 2. Alors, s'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Il y aura un court délai vous permettant de vous enregistrer dans la file d'attente pour la période de questions. Merci de patienter. The first question, la première question, is from Annie Bergeron Oliver from CTV National News. Please go ahead. Your line is open.
Hi there. Thank you very much for taking my question. I'm wondering if you can talk a little bit about the timeline, how quickly there will be enough vaccines in the country for kids, and do you anticipate this vaccine being annual for children?
Hello, this is Teresa Tam. I'll take the first question. There will be another press conference by ministers later on today, and there'll be more announcements in terms of specific timelines for the delivery of the pediatric vaccine from Pfizer-BioNTech. As you've heard before, other ministers have already indicated that we have been working very closely with the manufacturer, and that after authorization from Health Canada, we expect to get our supplies very quickly. But you will need to stay tuned to the press conference this afternoon. But just to add that we've been working very closely with provinces and territories through our National Operations Center to make sure that everyone is ready in terms of the delivery, the logistics, and the rollout of the pediatric immunization programs, so that all the provinces and territories are looking forward to be able to offer this vaccine to kids. As to whether anyone needs more doses of COVID-19 vaccine, remains to be seen. I think we are continuously learning about this virus and its evolution, as well as learning about the vaccines and the performance. So we need to track to see if the virus itself evolves. But I think it's too soon to say what might happen on an annual basis, but we will be communicating that as we go along as well.
Thank you. Merci. The next question is from Olivier Ferron-Boissé, TVA Nouvelles. À vous la parole.
Olivier Ferron-Boissé, TVA Nouvelles.
Oui, bonjour. Ma première question,
Hello, my first question.
J'aimerais savoir, est-ce qu'il va y avoir des mesures pour encourager la vaccination chez les parents qui pourraient être...
Will there be measures to encourage parents to have their children vaccinated? Answer, this is Dr. New. I'm not sure I understand the question properly. Can you repeat it? Question, I would like to know if there will be any campaigns to encourage parents that might be concerned about getting their children vaccinated. Answer, thank you for the question. We are going to continue with our collective efforts nationally with the provinces and territories. But also at the local level, we can encourage vaccination among children. This is part of internal campaigns to vaccinate children against other childhood illnesses. So this is something we're going to continue doing, and now we're going to target those efforts on COVID-19 specifically. It's a different vaccine. The circumstances are different. The vaccines are different compared to other vaccinations for children. But the vaccine was approved for children, and after the results of the clinical trials, Health Canada had the data to show that the vaccine was safe and effective. And we're going to make sure that this information flows down to the provinces and territories. But this is always a question with vaccine rollouts. We're going to see if there are any gaps or challenges for some programs in provinces and territories. Of course, everyone can make adjustments. This is Dr. Tam. I would like to add that we will have a media campaign coming shortly. It will be targeting parents. We are also working closely with healthcare professionals, including pediatricians.
Healthcare professionals, including pediatricians, who are the trusted sources, as well as family physicians, pharmacists, and other health professionals. They're trusted sources for parents and their kids. And so we're working through all of those channels, as we've done in the last many months and the rest of our vaccine campaigns. And so we would expect that all of these players will accelerate their support and communication and provision of information to parents. We will also be engaging people who parents connect with on social media and other channels as well. So you will see that escalating in the coming days.
Follow-up question? Follow-up question. We know that children of those ages are growing. Would a third of a dose, the 10 micrograms, be sufficient for an 11-year-old that might be the same size of a 12 or 13-year-old? Do we have any data on whether or not 10 micrograms would be sufficient for all children?
Oui, certainement.
Answer. Yes, we analyzed immune responses among a population of children aged 5 to 11, and we can confidently say that with 10 micrograms, the dose is sufficient to generate an immune response. It's also important to note that children have very responsive and strong immune systems, so a dose like this would be just as effective with an 11-year-old and will generate similar antibodies as a greater dose for older children. So there are no preoccupations on that front.
Merci beaucoup. Thank you.
Thank you.
Operator, could we go back to Annie Bergeron-Oliver? I understand she was cut off from her follow-up. Thanks.
Perfect. Thank you.
Hi.
Your line is now open.
Thank you very much. I appreciate this. My question is whether Pfizer is still considered to be an experimental vaccine. And I'm wondering if Health Canada and PHAC are conducting or planning to conduct any of their own research independent of the Pfizer study.
So once a vaccine has received its authorization, it's not considered to be experimental or in that experimental phase. When we think about experimental vaccines or ones that are in development, those are ones that we're doing lab studies on or through those clinical trials. So I just want to say definitively that we would not consider this an experimental vaccine, and it has been authorized through the regular pathways as we would with any vaccines. In terms of the ongoing monitoring, there are requirements on the manufacturer to provide continued monitoring of all the people that were in the clinical trials, and that includes all the adults and all the children up to 2 years after those clinical trials. But we also have the benefit of having hundreds of millions. There's been over 1 billion doses of mRNA vaccines given around the world, and we're working internationally with all of our counterparts to get additional information from that real world experience as we go forward. So, you know, it really is a global effort, and we're using all of those sources of information. And if anything comes up, then we'll make the appropriate changes to the regulatory status here in Canada.
This is Teresa Tam. I'll just add that Canada actually has played a significant international leadership role when it came to, for example, the longer interval between doses. Here, NACI is also recommending a dose interval between the first and second dose of 8 weeks or more. So, of course, I expect Canada and my colleagues and the researchers in public health to continue to monitor the vaccine effectiveness, overall in Canada, and certainly tracking that in the younger age groups as well, because we will be contributing to the global knowledge on that front. And as I've said in my remarks, the NACI recommendation came as a result of examining two significant aspects for that recommendation. One is our experience in the adult age groups, that the longer interval results in a stronger, longer-lasting immune response. At the same time, it may lower the risk of myocarditis and pericarditis. And all of these research comes from the Canadian context. So we will continue to work with our partners on that front. And as usual, we will be monitoring through our surveillance systems as well the evolution in the vaccine effectiveness, but also safety. So we expect that, I'm really thinking that Canada would again step up and provide that kind of research and surveillance information that the world needs.
Thank you. Operator, we can go to the next question, please. Prochaine question, s'il vous plaît.
Thank you. Merci. The next question is from David Thurton from CBC News. Please go ahead. Your line is open.
Hi. Yes. Good morning, everyone. With the dosing interval that you're recommending, 8 weeks, kids won't be able to be fully vaccinated before the holidays. So can you tell us how protected are kids with only having one dose? And then quickly, are there any concerns with combining, this vaccine Comirnaty with a flu shot? Because, of course, we're in flu season as well.
Yes, I'll tackle maybe the last question first. As mentioned in my remarks, at this point in time, NACI is recommending that the COVID-19 vaccine for children who are 5 to 11 years of age be given at least 14 days apart from the other vaccines, either before or after the other vaccines are provided. This, I think, is normal for NACI, because what we want to do, as we did with the adult vaccines, by the way, is at the beginning, we said separate the COVID-19 vaccine administration from other vaccines so that we can monitor any reporting of adverse events following immunization. But NACI will be re-examining that in due course. I'm going to, in a moment, ask Dr. Tunis to provide any additional comments. But the other question in terms of the stretch interval for completing the full vaccination, we know there are many other layers of protection that we can apply to protect children during this time. We've been doing that. We need to continue to do that. Because as I said, that the epidemiology is a little uncertain at the moment. We're going to get some turbulence, some up and down in our epidemiology in different parts of Canada. So we need to layer on the many different layers of protection in order to reduce community transmission, which is extremely important for protecting children and keeping them at school. And we've been able to do much of that. The vaccine will add another layer of protection. But I think parents need to be provided information that they need to make an informed choice. And the NACI recommendation will be taken into account. But maybe Dr. Tunis can comment on any additional work that NACI will be doing on both of those fronts.
Yeah, thank you, Dr. Tam. So with respect to the co-administration of COVID vaccines in children with other vaccines, as Dr. Tam has outlined, this would be a normal progression that we saw the committee implement early on with the adult vaccines as well, that over time, as we can accumulate more surveillance, there may be a shift towards recommending that those vaccines can be administered concurrently. That is now the recommendation for adults and adolescents, and we've seen that in actual studies that COVID vaccines in adults administered at the same time as influenza, that can be fine. So that's something that we'll continue to watch, and the committee is watching, and that may evolve over time. But in the early rollout, it's going to be important also to be able to contribute to a global safety surveillance community that we can really clearly identify any adverse events that are coming from the COVID vaccine. With respect to the protection during that interval, Based on the clinical trial, we don't know what the effectiveness is between the two doses. However, we have very strong evidence from the adult and adolescent programs that when the interval is longer, the final effectiveness is higher. So the protection overall, if we think about the population level, if that's what NACI is recommending on, how do we achieve the strongest population protection? And so our experience with those other vaccines with the adults and the adolescents shows us that when the interval is longer, the end result is a higher effectiveness. You can gain approximately 5 to 10% final improved effectiveness by using that longer interval. And then of course, there's also, as Dr. Tem mentioned, the precautionary approach based on emerging data from Canada that are being analyzed right now, showing that there may be that you can actually have a lower risk of something like myocarditis with a longer interval. So, well, based on the trial, we don't have an efficacy or effectiveness estimate between the doses. Our strong experience with the adult and adolescent program, and also the basic vaccinology and the biological knowledge that children respond very well to vaccines and very strongly. Their immune systems are very well designed to do this. So there's an expectation that that you would see a similar pattern of immunity and protection during that interval as we have seen with the adolescents and adults. Thank you.
And perhaps just to add, so just on the co-administration, as Dr. Tam and Dr. Tunis has said, the reason that it's being spaced out is because, if you get a side effect in that period after the vaccination, it's good to be able to know potentially what vaccine it's related to. There's nothing about these vaccines, the flu vaccine and the mRNA vaccines, that would cause us to think that there were safety issues or risks associated. It's really just about having an accurate picture of side effects and what they might be related to. On the issue of effectiveness, we do know the clinical trials were set up to have 2 doses. You need that second dose to have that sustained immunity. As others have said, extending that interval may give you more, sort of a more robust, a stronger immune response for longer. And when we looked at the clinical trials, there's not that many cases of COVID-19. So it's difficult to estimate how much immunity you might get from one dose. In the clinical trials, there weren't any cases of COVID between the first dose and the second dose. But again, that was only 3 weeks spaced apart. So that's a small period of time and a small number of cases. If we look at older children and adults, we can estimate potentially about a 50% protection or level of immunity with that one dose. The vaccine has been authorized in Canada as part of that, based on the clinical trials, for a 3-week interval. So I think it really is a discussion with healthcare practitioners and discussions that we'll have with other provincial and territorial counterparts about whether or not it'll be offered at a shorter interval as well for some patients. So I think it's something to consider especially as we're heading into, as we said, the holiday season, as well as I think a lot of families are considering planning trips abroad, and some of those countries do require 2 doses and might require that for younger children as well. So I think all of that needs to be considered as people are making their vaccination choices.
Thank you. Any follow-up, Mr. Thurton?
Yes, and thank you for those responses. Very fulsome. We appreciate that. Just switching gears here, because of course, there are going to be parents that are really concerned about this vaccine, and I'm just wondering, can any of you who are on the panel on this interview today, this press conference, today, just kind of put this in context? How do the risks of COVID-19 stack up when it comes to, other risks in the day-to-day lives that children face? The risks that we kind of take for granted, whether it's playing sports, whether it's doing other things. I wonder if you could speak to that, or maybe even just speak to, how many children have died or been severely hospitalized by COVID-19? Because, it's important, I think, that we put this thing in context here.
Okay, maybe I will start. This is Teresa Tam. So as we've said at the beginning of our remarks, children have been impacted by COVID-19 in many different ways. Children 5 to 11 generally get milder illness. Some of them may be asymptomatic, but some of them will get severely sick. And some of them might develop severe outcomes, such as the multisystem inflammatory syndrome that has been mentioned, where the hospitalization rate is very, very high. And so in terms of the statistics, I can provide some of that, but we're happy to provide more later on if you need it. The 5 to 11 year age group now has the highest incidence of all age groups, including overtaking the 12 to 17-year-old in terms of case incidence and the younger adults who had been at the highest rates. And there are most of the outbreaks now that are reported to us are from the school and daycare setting, and especially in primary school. So we know that school outbreaks and disruption to education has a big impact on children as well. So that needs to be taken into account. Kids have endured quite a bit during this very long pandemic trajectory as it stands. We need to do everything that we can to help them stay in school and regain some of that normality. And it will allow them to participate more in some of the fun things that they want to do as well. So of the 5 to 11 years of age, we've had about 123,379 reported cases, 300 hospitalizations, 48 ICU admissions, and unfortunately 2 deaths that were reported. So as you can see, the severe outcomes are relatively low. The broader impacts are quite high amongst the age groups. And so I think parents need to be provided with that information to make their informed choices. On the other hand, you've just heard that through clinical trials that have been thoroughly studied by Health Canada through their rigorous process of review, that the benefit outweighs the risks. There was no significant safety signals in these initial trials, and we'll be continuing to monitor that. And parents should rest assured that we will communicate even rare outcomes that might come along as the vaccine programs rolled out. But you've also heard that the vaccine efficacy has been estimated to be just over 90%, which is amazing. And so I encourage parents to discuss these benefits and risks with their own healthcare provider.
It's Dr. New. Maybe I could just add a sort of a personal touch. You know, certainly Dr. Tam has stated all of the good reasons at a population level why, children may be offered and with their parents the Pfizer pediatric vaccine. I can say that, I'm a physician, but I'm also a parent, and certainly looking at the risk and benefits of the vaccine. I've seen what happens in the rare cases of severe illness. Obviously, no one knows what's going to happen in the future with long COVID, other longer term effects in terms of children's health, and as well, the fact that the children's lives have been disrupted. There's many other collateral, I would say, harms. In terms of interruptions with the school year, activities with their friends, and so on. So I would say, without hesitation, as a parent, that I would have my kids vaccinated. It's obviously a bit sort of hypothetical. My kids are all in their 20s now, but I would not, without hesitation, have my kids vaccinated if they were in the age group that would be eligible for the vaccine today.
And just to add as well, I think we need to really, if I'm talking to parents directly, but, of course, it's important to be able to make sure that you have the information to make the choices that you need to make for children. And you can understand if somebody's making a choice about a vaccine, and there's a worry there that what if something happens? But I think, not choosing to get the vaccine for your children is also a choice. And the risks of, things like heart effects. If we're looking at myocarditis or pericarditis, which I know is, it's a concern that potentially might be there for children. In this age group, we think that risk is likely lower than it is for older age groups. But the other thing is that if you get COVID-19, your risk of myocarditis and pericarditis can be 20 times that, estimated for that following the vaccine. As well, with this multi-system inflammatory disease, that can have heart effects as well. And even the long COVID actually has cardiac effects as well. So, I think that it's just that's when we're looking at the overall use of the vaccine and the risks and benefits. That's what we're talking about. We're talking about if you get a vaccine and that it gives you immunity against basically 3 new diseases that we have not seen before: severe COVID, this multi-system inflammatory disease, and long COVID. And it also will give children protection against transmission. And we know that with vaccination, your likelihood of getting COVID is lower, so therefore your likelihood of passing it on is lower. And then if you have protection against that, your risk of passing it on because you're shedding the virus for longer is lower as well. So I think it's really important to be compassionate. I think it's really important that parents feel comfortable and confident in their decisions. That starts with having adequate and accurate information. So we put that out at the federal level at Health Canada and the Public Health Agency. I think having conversations with healthcare practitioners or public health experts is really important as well, so people can feel comfortable with the decisions that they're making. But what we're saying today is we're authorizing the vaccine for this age group because those benefits outweigh the risks for COVID-19.
Thank you. Operator, next question, please. Prochaine question, s'il vous plaît.
Certainement. La prochaine question est de Boris Prou, Le Devoir. À vous la parole.
Boris Prou from Le Devoir. Question. You talked about the delay between first and second doses. I need more explanation. How come in the press release from Health Canada, what was approved was a 3-week interval, and then NACI mentions an 8-week interval? Is the 3-week interval a manufacturer recommendation? Would that still be authorized? And then the provinces decide what the ultimate interval is? Answer, this is Dr. New. I can start, and my colleagues from Health Canada can jump in after. What we're seeing with the approval of the vaccine by Health Canada, Health Canada uses data and results from trials to decide. So participants in trials had a 3-week interval. So the approval is based on the data and with the information provided by the manufacturer. But NACI and the provinces and territories have access to other data with regards to actual efficacy rates. We have observed in adults that a longer interval between the first and second dose leads to stronger immunity. Even in the rare cases of myocarditis and pericarditis in adolescents, we see that a longer interval between the first and second dose can reduce incidence of those very rare risks of myocarditis and pericarditis. This is why NACI has used other data to make a recommendation that the interval be extended to 8 weeks or more, and the provinces and territories can consider this recommendation. And we see that already the provinces and territories have studied the data, and some have already announced how they will be using the pediatric vaccine. And they may also using longer intervals in their own vaccination rollouts. I'd like to jump in. As mentioned by Dr. New, Health Canada is reviewing studies. The studies that were submitted to Health Canada used a 3-week interval. This is why Health Canada has provided this recommendation. NACI makes recommendations that are based on Health Canada's recommendation, but also uses other considerations. We look at experiments that were made on other age groups during the pandemic, and that way each province can decide on the approach that they will use with regards to the interval. Thank you.
Merci pour ça.
Thank you. Question. The question is on the 10 milligram vials. If I understand correctly, are these completely different vials that we're receiving from the manufacturer? Do we already have some? Or could we use a 30 milligram vial and then split it to make 3 vials for children, or is that not how it works? Answer. The vials that were approved that will arrive in the Canadian market soon are different. The ARN messenger that is used is slightly different with regards to product stability. The concentration is slightly different because the vials are completely different. The adult vial has a purple cap. The pediatric formulation has an orange cap. So the hypothetical question you're asking, since we're not expecting supply issues with the pediatric formulation, there really is no need to use adult doses to create pediatric doses. It wouldn't be recommended anyways because it involves risks related to manipulation and an increased error rate. So manufacturers are recommending that we use pediatric vials for the use that they were approved for. Here's Dr. New adding in some more information. There will be another press conference with the minister later today at 1 p.m. Eastern Time, and we'll be able to provide more details on that later.
Next question, please, operator.
Thank you. Merci. The next question is from Laura Osman, The Canadian Press. Please go ahead. Your line is open.
Good morning, doctors. Thanks for sharing this exciting news today. I have a question for you about the NACI recommendations, and I'm hoping Dr. Tunis and Dr. Tam can both weigh in. It's about the distinction between the recommendation for kids 12 to 16 and for children. For kids 12 to 16, you say they should be vaccinated. For children 5 to 11, you say they may be vaccinated. I'm wondering if you can explain the distinction and what it means for sort of the cost-benefit analysis to children, and as well how important it is for parents to vaccinate their children in terms of Canada's larger vaccine strategy to combat the pandemic.
Thank you. I will start, and then maybe Dr. Tunis can provide further details in terms of the NACI decision and recommendation and how they're positioned. But first of all, I would like to thank NACI for all the hard work. It's not unusual at the beginning of any vaccine recommendations for NACI to begin by saying may be offered to a certain group of vaccinees just because of the information that they have in front of them and the size of the trials, for example. But we expect NACI to continue to evaluate that information. And as with some of the adult recommendation, they can shift over time to strong recommendations. But the bottom line is that Health Canada has authorized the vaccine based on the examination of the safety data, the quality, and the efficacy. And NACI has examined that data very thoroughly as well and indicated that this vaccine should be offered to kids 5 to 11. So over to Dr. Tunis.
Yeah, thank you for the question. So as Dr. Tem alluded to, NACI is an advisory body who provides advice to the Public Health Agency of Canada, provinces and territories, healthcare providers, and there's a standard nomenclature of how they approach providing that advice to communicate messages to the decision makers. So it is, this is the way that they express the different levels of recommendation they have should be offered or may be offered as strong and discretionary recommendations. This is a standard structure that the committee uses. And as Dr. Tem outlined, this is actually a fairly normal progression of advice that we see coming from NACI. If we look at the early recommendations around pregnancy or immunocompromised populations in adults. Those started off as discretionary, may be offered recommendations. Same with heterologous or mixed schedules, started as a may be offered. And then as the evidence base evolves and expands and strengthens, then the committee, in many cases, does actually shift their advice towards a stronger should be offered position. So I would say that this is a communication of the state of evidence as things are evolving. It's a fairly normal position for an advisory committee to take early on, and we'll see how things evolve over the coming weeks and months, where we have really close ties with the Center for Disease Control in the US, where we know over 2 million doses have already been, first doses have been administered. And so they have regular channels to present to NACI, and we have communication lines. So as we are learning more, as that body of evidence is growing and growing, very rapidly, then the committee is going to continue to reevaluate. So we'll watch carefully, and we'll adjust that advice as needed as the committee provides us those recommendations.
In terms of the overall impact of pediatric programs, our modeling teams, you've heard of the modeling in the past. They've been doing a lot of work in modeling the trajectory of the pandemic and inputting the impact of vaccinating younger age groups, as well as some of the knowledge that we have and uncertainties about waning immunity in different age groups. So there's still some uncertainty in their modeling estimates, but certainly in combination, increasing booster doses to the segments of the population that is experiencing waning immunity, as well as increasing vaccination coverage in younger age groups, together will serve to help get the pandemic further under control. And so there will be a contribution of vaccination of this age group to the trajectory of the pandemic. It all depends on the level of uptake, of course, in this population, as well as the timing of the epidemiology and the different ups and downs that we might experience in the coming weeks and months. But we do expect that to provide a contribution to the impact of the pandemic.
Any follow-up?
Thanks so much. And this is early days, obviously, but as doses start to go into the arms of kids, the federal government and provincial governments are going to have to start to think about whether their vaccine mandates are going to apply to children, particularly at a federal level for, airplane travel, that sort of thing. And so I'm wondering, Dr. Tam, what your recommendation would be at this point as the federal government starts to consider those measures.
Well, at this point, our perspective is that we shouldn't include a pediatric mandate at this point. The vaccine program is just rolling out, and there's very little access anywhere else in the world to pediatric vaccines. We're one of the first countries that have been privileged, I would say, in getting these pediatric doses. And so for the purposes of travel, for example, I don't expect that we will be requiring this. But of course, we'll be examining all of these policies as time goes by, but not at this point.
Okay, thank you. We'll have to end it there. This will conclude today's technical briefing. Thanks for your participation. Any additional questions can be directed to Media Relations at Health Canada and the Public Health Agency of Canada. La conférence de presse est maintenant terminée. On vous remercie de votre participation. Si vous avez d'autres questions,
we were listening live there to the Public Health Agency of Canada giving us details of this new Pfizer-BioNTech vaccine for kids who are between the ages of 5 and 11. If you are just joining us, hello to you. Welcome to CBC, the newsroom. I'm Suhanna Marchand. Forgot the name of the show for a moment there. Has that ever happened to you? Anyway, the big news, the takeaway from here is this vaccine for children in Canada. So why don't we just take a quick look at some of the key points. Trials show this jab is 90% 0.7% effective at preventing COVID-19 in this particular age group. Slightly different in the 5 to 11-year-olds than in the 12 to 17-year-olds. Each dose is 1/3 the size